Okay, hi, it's Dr. Buford. We're just getting started on the left shoulder. We're looking in from the front to the back. Here's our initial look. Here's our great cannula coming in. Remember, you're laying on your side and everything's magnified 30 or 40 times on the screen. First thing we look for is the biceps tendon. You had some biceps tendon symptoms, and you've got some degenerative changes here. Just about rises to the level of doing a soft tissue tenodesis. Let me see, hold the camera there. Spinal needle, yeah. So there we have a needle coming right through the biceps. Hold the camera there. Yep, grasper to Garth. We're going to pass a black wire called the super shuttle through that needle. Got it. And we'll retrieve it like this. We'll back the needle out. We're going to load this with a particular, keep me real good right there. Load this with a suture. And now we're going to do the same thing one more time. There, I like that a little better. We'll pass that wire through again. I got it. Okay, so once we pass a bunch of this wire in, we're going to grab it and retrieve it again. We have a little trick here, so we'll tell you when to look to see what the difference is this time. We'll grab it. Now notice here, we're not going to pull it straight out like that. We're going to leave it, and we're going to sneak around the back of the biceps tendon like this. And now we retrieve it. And that's going to give us a stronger stitch around and through the biceps tendon. You can see as we pull back. See how that gives us a loop all the way around the biceps now. See that? And now we'll come back around. Now we'll take a pair of scissors and we will carefully cut the biceps at its base. Okay, hold just like that for me. There we go. We just got a little hung up with our cannula, but we're going to cut down here at the base. Okay, and so now that biceps is released. You can drop her pressure. Oh, you already got it. Under 100. Okay, hold the camera here. And now we're going to use our shaver just to smooth out the rest of the labrum here. There's not much we really have to do now that the biceps has been released. Okay, so next we'll look up at this rotator cuff tear. And here's the tear in the rotator cuff right here. Hold the camera right there. So we'll rotate the camera around. And this is where this rotator cuff is going to need to be stitched back to the bone. Can I get a little marker stitch like a number 1 PDS? Okay, so that's our tear in the tendon. Hold the camera there, please. We're going to go ahead and look around the rest of the shoulder just to make sure there's nothing else to worry about. I do not see much arthritis. Posterior shoulder looks good. The humeral head looks pretty good. Posterior glenoid looks good. The anterior shoulder anatomy looks pretty good also. Okay, so we're going to take a spinal needle one more time. And as you see here, we're going to pass it right through this hole. Hold the camera there. And now through that needle, we're going to pass this purple marker stitch. This doesn't stay in. It's not involved in the repair. It's just to allow us to find this area very quickly on the other side of the tendon here. Okay, so here's the tear in the rotator cuff. We've already taken off some bone up above, a little bit of what we call decompression. We can do a little bit more there to polish it. We'll do that towards the end. And now we're going to go ahead and plan our repair here. We'll go ahead and take a spinal needle. And if we can get down past the acromion here, we'll see the needle come in. There it is right there. Okay, so we'll show you some more in just a minute here as we get ready to place the anchor. Here's the needle coming down. There's the articular surface. We want to come back about 5 or 6 millimeters, maybe at a slightly steeper angle. So a little bit steeper like that. That looks like a pretty good spot for a suture anchor right there. Okay, hold the camera. Okay, so here's the anchor in the bone. I like the position there. Next, we're going to take our crochet hook and we're going to take our sutures out of the blue cannula here. We want them all. You can let go. Okay, just like that. So now our sutures are in the cannula, so we can pass our implant down. Sorry, I'm just trying to arrange something here on the outside. So you can pass our implant down through there, just like that. Okay, hold the camera. I just wanted to show you a picture of us placing the implant in position. We're just manipulating it down the way we'd like it to sit. I think that's about all we're going to get there. So I'm going to take a suture out of the front here. Do you have the crochet hook? We'll show you some more in a minute. Okay, so here's our suturing device. Hold the camera right there. And we're trying to grab the full thickness of the tendon without getting there. Now we're through all the way. Make sure that implant stays down. We'll feed this out. and retrieve it. Go ahead and load. Okay, so here's the first stitch passed. We haven't tied it yet, but that's going to sit like that. We're going to readjust the implant in just a minute, but the next suture that we'd like to work with is this one here. So now we'll show you some more in a little bit. Okay, here's our second pass, just showing that we're not getting the graft here. We're just through the tendon. Just wanted to show you that. Hold that. Just wanted to share our picture here. We've got 2 sutures passed. We're about to do the third. The third one's going to come in from the front. We'll show you that in a second. Okay, so all 3 sutures are passed. You can see 1, 2, 3. I like the way that looks there. We're going to go ahead and retrieve all the sutures and start tying them now so we can get this thing fixed for you. Let me get a little... So we've got our sutures tied for the rotator cuff repair. That looks very good. There's a little bit of extra graft right there. We can snip that away. We'll do that in just a second with a little suction punch. And then that's the stitch for your biceps tendon. So we've got 3 for the rotator cuff. Looks really good. A little bit extra graft pooched out at the back there. That's because the implant was a little bit larger than the space. So this looks good. We're going to get you back to the recovery room shortly. Good luck to you now. Bye-bye. Okay, just want to show you how we really fine-tune this with our little suction punch. So I think we're done, okay? And I like the way that sits, okay? So good luck to you now. Bye-bye.